If you have noticed that you reach climax but little or no fluid comes out, or sometimes nothing at all, and you have felt confused, worried, or even a little embarrassed about it, I want you to know something important right away. This is one of the questions I get asked most often in my clinic, usually in a quiet voice, near the end of an appointment, after the patient has decided whether they trust me enough to bring it up. And every time, my response is the same. This is not a sign that something is wrong with your masculinity. It is your body sending a signal, and signals can be understood. Today, I want to walk you through exactly what is happening when this occurs. The difference between climax and ejaculation, because they are two separate processes, even though most men assume they are the same thing. The most common causes, including one medication that millions of men over 50 take, without knowing it affects this. A simple thing you can check at home that gives you a real clue about what is going on. And when this is something to simply understand, versus when it is something to get checked. My name is Dr. Elizabeth Kavaler. I am a board-certified urologist and urogynecologist with over 20 years in clinical practice. I have had this exact conversation with patients more times than I could count, and I know that for most men, the hardest part is simply asking the question. So let me answer it as clearly and kindly as I can. Here's the first thing I want you to understand, because it changes how you think about everything else. Climax, what we sometimes call orgasm, and ejaculation are two separate physiological events that normally happen together, but do not have to. Climax is a neurological event. It happens in the brain and nervous system. It is the sensation, the rhythmic muscular contractions, the release of tension. Ejaculation is a mechanical and hormonal event. It is the physical process of seminal fluid moving through the reproductive ducts and out through the urethra. In a younger man, these two events are tightly coupled. Climax triggers ejaculation, and they happen as one experience. But the coupling between these two systems can change with age, surgery, medication, or hormonal shifts, while the climax sensation itself often remains completely intact. This is the single most important thing to understand. If you experience climax, the sensation, the release, but with reduced or absent fluid, your nervous system and your sexual response are working. What has changed is the mechanical or hormonal side of the equation. You have not lost your masculinity, your desire, or your ability to experience pleasure. One part of a two-part system has changed. There are three main reasons this happens in men over 50, and identifying which one applies to you is genuinely useful. The first and most common cause is retrograde ejaculation. This is where semen, instead of traveling forward and out through the urethra, travels backward into the bladder. This happens because of a muscular valve called the bladder neck sphincter. Normally, during ejaculation, this sphincter closes tightly, directing semen forward. If this sphincter does not close properly, or relaxes when it should not, semen takes the path of least resistance, which is backward into the bladder. The most common cause of retrograde ejaculation in men over 50 is medication, specifically alpha blocker medications such as Tamsulosin, commonly prescribed for an enlarged prostate. These medications work by relaxing smooth muscle in the prostate and bladder neck to improve urine flow. The same relaxation effect on the bladder neck sphincter is what causes retrograde ejaculation. This is an extremely common and under-discussed side effect. Millions of men take Tamsulosin for BPH symptoms and are never told this might happen. The second cause is related to surgery. Procedures on the prostate, particularly a transurethral resection of the prostate, known as a TURP, and radical prostatectomy for prostate cancer, directly alter the anatomy of the bladder neck and the ejaculatory ducts. After a TURP, retrograde ejaculation occurs in the majority of men because the surgery widens the bladder neck channel as part of its therapeutic goal. After a radical prostatectomy, the prostate and seminal vesicles, which produce the majority of seminal fluid volume, are removed entirely. In this case, there is no fluid to ejaculate at all, even though climax sensation typically remains intact. This is an expected and permanent anatomical change, not a malfunction. The third cause is hormonal, specifically declining testosterone. Testosterone supports the function of the seminal vesicles and prostate, which together produce most of the fluid volume in semen. As testosterone gradually declines with age, semen volume can decrease progressively over years. This tends to be a gradual reduction rather than a sudden absence, and it often occurs alongside other symptoms of lower testosterone, reduced energy, changes in libido, or changes in muscle mass. Here is something genuinely useful that most men have never been told to look for. If the cause is retrograde ejaculation, semen traveling backward into the bladder, the next time you urinate after climax, your urine may appear cloudy or murky because it contains the semen that traveled backward. This is a simple, harmless, and very informative clue. Cloudy urine shortly after climax is one of the clearest signs that retrograde ejaculation, rather than a hormonal or surgical cause, is what is happening. If you take an alpha blocker medication like Tamsulosin and you notice this pattern, the connection is very likely your medication's effect on the bladder neck sphincter. And this is genuinely worth a conversation with your prescribing doctor, because in some cases, an alternative medication or adjusted timing can reduce this effect if it is bothersome to you. Let me give you the clearest possible guidance on what to do with this information. If you take an alpha blocker medication for prostate symptoms and you notice reduced ejaculate volume with normal climax sensation, this is a well-recognized medication effect. It is not dangerous. If it bothers you, mention it to your doctor, because medication adjustments are sometimes possible. If you have had a TERP or a radical prostatectomy and you are experiencing reduced or absent ejaculate, this is an expected anatomical consequence of the surgery. It does not indicate a complication, and your surgical team should have discussed this with you beforehand as part of informed consent. If the change has been gradual over months or years and is accompanied by reduced energy, lower libido, or other signs that might suggest hormonal change, this is worth discussing with your doctor as part of a broader conversation about testosterone levels, which can be checked with a simple blood test. Here's when to seek prompt medical evaluation rather than simply monitoring. If the change in ejaculation is sudden and you have not started a new medication or had a procedure that explains it. If it is accompanied by pain. Pain during ejaculation is never something to simply observe. It warrants evaluation. If it is accompanied by blood in the semen or urine, or if you have any new urinary symptoms alongside the change, difficulty urinating, urinary retention, or fever, which could indicate an infection or obstruction requiring attention. I want to spend a moment on something that matters as much as the physiology, because I see its impact regularly in my practice. Many men experience this change and quietly assume it means something about their masculinity, their age, or their relationship has fundamentally shifted. And they do not talk about it, not with their partner, not with their doctor, sometimes not even acknowledging it to themselves. That silence is where the real difficulty often lives, not in the physical change itself, but in the isolation of not understanding it. Partners frequently misread the change too, sometimes wondering if it reflects something about attraction or desire, when in fact, it has nothing to do with either. If you take one thing from this video beyond the physiology, let it be this. This is an extremely common experience. It has understandable, often simple explanations. And talking about it with your doctor, and if you feel comfortable, with your partner, replaces confusion with clarity almost every time. Climax without ejaculation or with reduced ejaculate is one of the most common and least discussed experiences for men over 50. Most of the time, the explanation is straightforward. A medication you are already taking, a surgery that changed the anatomy as expected, or a gradual hormonal shift. Understanding what is happening removes the fear. And in the cases where evaluation is genuinely warranted, getting checked early gives you answers and options rather than uncertainty. You have not lost anything that matters. Your body changed how one part of a two-part system works. That is worth understanding, not worth being afraid of. I am Dr. Elizabeth Kavaler. I will see you in the next video.